Going to look at some health headlines. Last week we talked about magnesium. That got a lot of people's attention. We were referring to sleep. So now we're talking about magnesium in food, decreasing your risk of dementia is the possibility there. How are BMI and breast cancer linked? And to answer these questions and more, we've got WWL Louisiana Chief Medical Correspondent Dr. Corey Hebert. All right, so magnesium and sleep, that was a hot topic. Now magnesium and food.
Right, because magnesium glycinate with L-theanine, right, those were the things that decreased your insomnia, okay, so helped you sleep. But there's a new study that came out very recently that said that if you take magnesium, then you would have a decrease in cognitive decline or decrease in dementia. So I did a lot of scouring of all these types of studies, and really what it looked like is that you can't really say that 100%. Does magnesium help you sleep? Yes. But does it decrease your cognitive decline? Does it decrease dementia? We can't say that it does. It looks like it does anecdotally, like some of the evidence shows that, but it's not statistically significant. Does it hurt you? Not at all. So taking magnesium can possibly decrease your risk of dementia, but it's not been proven.
Okay, that's what I was just about to ask you, because a lot of these you say, okay, when I do my research, I can find some things that support, but it's never 100%, and until that point, you can't for sure say. But if it's not hurting you, then maybe go ahead and do it.
Right, and the thing is that it does help you sleep, and getting good sleep does increase your quality of life. So when we look at the causality versus correlation, we talk about this all the time. Just because something happens sometimes doesn't mean that something caused it. So it won't cause you any real problems at all, but it does help you sleep. So go for it. Let's move on to the breast cancer thing, because this is a really big deal. So study looked at how many thousand? 168,000 women, okay? And they were postmenopausal, and they saw that if you had an increased BMI, that means body mass index being overweight, then you had a huge increase in the risk of breast cancer. All right, so look, this is from the whole concept of having a good BMI will help you. If you had each 5-point increase in the BMI was a 31% higher risk of breast cancer, folks, in women that had heart disease and you were postmenopausal. Heart disease is the #1 cause of death in everyone, black, white, man, woman. So the point is, if you have heart disease and you're postmenopausal and you have a high BMI, increased risk of breast cancer 31%, folks. We cannot allow this to happen. We know that you gotta lose that weight in New Orleans. I know we love to eat, but it just over and over it shows that. And our last thing, because I know that we are going to be moving on very quickly here, is constipation. Talking about diet, right? Nobody likes constipation. Chronic constipation leads to anal fissures, it leads to hemorrhoids, rectal prolapse, all this impaction, all these things. They hurt, and they also can make you have to have surgery and all types of stuff, right? But if you eat a plant-based diet or the Mediterranean diet, okay? They looked at 96,000 people in the journal Gastroenterology, and if you ate one of those types of diets, that means vegetables, fruit, beans, whole grains, olive oil, decreased red meat, and decreased processed meat, you had a 20% decrease in constipation. But if you ate our diets, full of processed meat, red meat, and sugar, and white rice, and all that kind of stuff, you had an increased risk, 20% of constipation. And so, and then don't even get me started if you go traveling somewhere and then you get there, everybody's constipated when they go on a trip, right? So before you go on a trip, make sure you eat a plant-based diet for sure, or Mediterranean diet, but all the time, eat this way, folks. It's not a diet. I hate to call it a diet.
There's like a long list of reasons why you should just be eating well.
But what we don't want you to do is just keep eating bad stuff, folks. It's not good for you across the board.
For so many reasons. All right. Thanks, Dr. Hebert.
Thank you.
We have these health headlines and many others on our website, WWTV.com, if you'd like to reference some of this information. Now let's get a check on our forecast with meteorologist Peyton Malone.